Oh, I don't have gravel. All right, good afternoon, everyone. I would like to welcome you all to the CPS Board of Education Health and Safety Committee meeting for September the 18th, 2023. We have here today with us, to my right is Board Member Jones, and absent is Board Member Morosky. I am the chair for Health and Safety, Mary Weinberg, and I would like to start off by introducing our guests that are here today. I'm going to start off with my left. We have the amazing, drum roll, Chief of Staff, Dr. Little.
Thank you.
Welcome, welcome. And then in the crowd, we have with us who will be presenting Sandra Jackson and Christy Woodworth with Be Smart. And then we have Mary Mounty with the Hamilton County Commission on Women and Girls. So our topic for today, we have lots of topics. They're going to include gun safety, menstrual health, physical and mental safety updates, athletics and extracurricular, and pedestrian safety. So as a reminder for those of you who have tuned in virtually, the documents that we will be reviewing for today's meeting will be available in Board Docs and will be shown on the screen. And for the members of the public who wish to speak, you may do so by clicking the chat button, or if you're here in person, do we have a piece of paper for them to sign up? All right. Well, if there's anyone here who would like to speak, they're more than welcome to sign up as well. Please submit your name, your affiliation to the district, your school community, your topic, and your contact information if you want a direct response to any questions that you might have. And we will hear from you during the hearing of the public towards the end of this meeting. So first up on our agenda, we have gun safety. Be Smart, secure gun storage. And we are going to have Sandra Jackson come on up, and you can come to the podium. And I think you have to press this little button that will magically make your mic red so that we can hear you. But welcome. Oh, it's right on the front. Oh, we'll get help. There we go.
Thank you, Board Member Weinberg, for the invitation to join you today. And thank you to this committee for the hard work that you do to support the health and safety of everyone touched by CPS. I appreciate the board's commitment to safety, particularly with regard to firearms storage. I've been serving in Cincinnati as the local lead for Be Smart since January 2021. No, excuse me, 22. I wish I could introduce to you today my co-lead, Katie Dooley, but she unfortunately had a prior engagement. So as a quick summary of our program, SMART is an acronym that encourages caregivers to secure all guns in homes and vehicles. Not only do we help keep minors safe from unintentional shootings, but a majority of guns that are stolen are used in crime. M stands for model responsible behavior. Keep your firearms secure and teach your children to never touch a gun, even if they think it's a toy. Find and tell an adult. A stands for ask about unsecured firearms in homes before you send your child to that home. It may seem awkward to ask at first, but just as important is asking if teenagers will be monitored when they're at someone else's home. R is recognize the role of guns in suicide. This one keeps me up at night. We all know that children have underdeveloped brains and are impetuous, and one bad day can become a tragedy if the child has access, the child or teen has access to unsecured firearms. And then the T is tell your friends to be smart. We want to share the word. Next slide, please. In April 2022, as you know, CPS became the first public school in the state of Ohio to pass a secure firearm storage resolution. So congratulations. That resolution mandated 3 tasks. Update the student handbook, create a letter to caregivers highlighting the importance of secure firearm storage, and continue to collaborate with local groups increase efforts to support secure firearm storage. Next slide, please. For the student handbook provision, I have received no request to provide information for that mandate or that update. However, I believe the student handbooks are school specific. And the code of conduct is the only district-wide resource I could find. It's not named there. For the letter to caregivers, however, I was invited to provide a brief message and created a draft of the letter you see there that was included in the 2022 and 2023 back-to-school packets. As for collaborating with local groups, I can confirm that we were permitted to table at the district-wide back-to-school picnic in both 2022 and 2023, where we were able to engage caregivers one-on-one and to distribute over 100 cable locks to secure firearms that are otherwise had not been secured. We were also permitted to provide printed materials at the Safety Town Hall in 2022. Next slide, please. So as for additional resources, we do have resources for social media available at besmartforkids.org. That includes brief videos that are about 30 seconds each and graphics like the one you see there, which can be very easily shared on social media. Those videos and graphics are available in both English and Spanish. We also would be delighted to set up a table for in-person caregiver events where we could engage parents like we did at the back-to-school picnic. We can again make cable locks available and direct parents to resources that are available online, like guides for spotting suicide risk, how to talk to kids about guns. And then we also offer a 15-minute presentation that we would be glad to share with any in-person groups that would be interested involving parents. And so lastly, I want to point out that outside of Be Smart, oh, excuse me, I skipped Students Demand Action. Any student who is interested in opening a group at their school, I am glad to put them in touch with somebody to get that started. That is another organization that operates adjacent, well, under every town for gun safety. And then finally, school safety. Beyond Be Smart, I'm happy to provide connections to our committee. Actually, she's right here. She just walked in. She made it. This is Laura Waniger. She is a CPS teacher who serves as our school safety lead for the Cincinnati chapter of Moms Demand Action. And so while Be Smart is focused on secure firearms storage, the school safety group, Laura, led by Laura, also creates public awareness and addresses concerns that extend beyond secure storage, making available current research and best practices for developing programs that address threat assessment, physical security, and emergency response. So Laura can help keep the committee apprised of legislation in Columbus and any recent laws that affect Ohio public schools. So thanks again for inviting me. Does anybody have any questions?
Thank you so much for coming to present. And I do have a couple of questions, but I'm going to look over to my right to my colleague to see if she has anything to add first.
I don't think I have any questions. I appreciate it. This is a subject matter that just never gets old. And I think we have to keep it in the forefront of our thinking, which is why I'm glad. I remember I was here when you all did a previous presentation. Ms. Waniger? I'm sorry, I want to make sure I pronounce your name right. What department are you in?
I'm teaching English as a second language.
Okay.
Yes.
Okay, so, oh, yeah, sorry. So
Sorry.
I guess one of the comments that I have, I agree that this is a subject matter that really kind of needs to infiltrate the district at various
Right.
levels. So I was just curious to know when you spoke to the fact that you would participate any place where parents and or students are involved. And this might be something for Dr. Little to consider, is that whenever we do community events or school-based programming where parents come in the building, it might be a good idea to somehow connect, to pass out literature or have presentations or things. And it may be something that you've already thought about.
That would
But
be
I'm
great.
just thinking about all of those broader opportunities.
Yes, absolutely. We could look into doing activities like that.
Yes, thank you.
Thank you. So the two questions that I have, I know you referenced the resolution, and this is actually going to be to Dr. Little. With the resolution, did we include that in this year's back to school? And do parents and families still have access? I know there was a link on the website at some point.
Yes, it was included in the back to school packet this year. So all grade levels, all families got access.
I apologize. It was in I said 22 and 23, but it was 22 to 23 and 23 to 24.
Okay, perfect. And I just wanted to make sure on that. And then one thing that I just wanted to suggest, and you don't have to take it, obviously, but June is, I think it's National Gun Safety Month. I think that's what it is. And is there any way that for our district that we can maybe do something, whether it's on the website, whether it's combining with Be Smart to post or just post something, whether it's on social media or on our website with a banner or something like that?
I think to this point, and what the comment about like being wherever students and parents are, I think we should follow up to think about what those opportunities look like across the calendar. We know through our parent voice work that there are sessions where we pull families together multiple times throughout the year, and this could be something that gets slotted into that programming as well. So in general, I think, yes, there's opportunity here.
Perfect.
If I may, when you mentioned June, we have a Wear Orange event that we host, Moms
Right.
Demand Action, and I'm sure that we can get you information to at least pass along the announcement of that activity.
Absolutely. Well, thank you so much. You're all done. Thanks so much. I appreciate you
Very
both.
much.
Thank you.
All right, up next to the mic, we have the lovely Mary Mounty with the Hamilton County Commission on Women and Girls discussing menstrual health and feminine products within the Ohio District, especially based off of the bill that was just recently passed with our funds.
Yes. Well, thank you so much to each of you for having me and allowing me the time to speak about this really important issue and menstrual health and no cost feminine products in Ohio. So just to start, next slide, with a little bit of background, starting in late 2022, Hamilton County Commissioner Denise Driehaus and myself, along with two colleagues from Cleveland, Ohio, formed the Coalition for Free Menstrual Products in Ohio Schools at the bequest of the Hamilton County Commission on Women and Girls, and proposed legislation to our Ohio legislature requiring Ohio public schools, including community schools, to provide no-cost menstrual products in all female and gender-neutral bathrooms in Ohio. With the championing of State Senator Nikki Antonio and State Senator Stephanie Coonsey, this July, we were successful in having a budget amendment passed that allowed Ohio to join the fast-growing number of states recognizing that, one, menstruation is a natural bodily function, and two, the health and educational experience of girls and young women will be improved by providing direct access to those products, just as the way that we do right now with toilet paper, soap, and paper towels. Next slide, please. As a quick reminder, around the topic of menstrual equity, lack of access to period products is the #1 leading cause of absenteeism in the United States. This is way more than the common cold. Therefore, increasing access to menstrual products, increasing access to education will improve health and increase student engagement. In coordination with Cincinnati Public Schools Administration, Mary Weinberg, Ohio Senator Catherine Ingram, and some former students of the Hamilton County Commission on Women and Girls, The Hamilton County Board of Commissioners announced this funding that came through the state and initiative to the community on July 26. Next slide, please. So to increase student wellness and address barriers that prevent students from engaging in learning, and schools, districts are now required under this sub-House Bill number 33, which was the state funding budget, under this certain section called feminine hygiene products, to require providing feminine hygiene or menstrual products for students in grades 6 through 12. In the 2022-2023 school year, there were over 476,000 female students in grades 6 through 12 that this new requirement will impact in Ohio. Next. We certainly can go back to the prior. There is going to be a budget allotment, or there is a budget allotment of $2 million across the state for the purchase of dispensers. Schools are required, or school districts were required to submit their funding proposal to the state through the Ohio Department of Education's website by September 15th. Schools are required to provide free menstrual products beginning October 3rd of this year. My understanding is that Cincinnati Public Schools has put in a request for that funding, and that you're still waiting to hear what that request, or how it will be filled. In 2024, school districts will be able to apply for reimbursement of funding for menstrual products up to, for the whole state, $3 million that's been allotted. So once again, it will be incumbent upon the school district to be able to track the amount of products that have been used at no cost to the students, so that you can be able to put in a funding request in 2024. And I'll get to some of the dates for that. So, slide, there we go. So effective on October 3rd, the Ohio law requires that each traditional public school district, community school, STEM school, chartered non-public school, and other public schools with school buildings enroll girls in grades 6 through 12, provide free menstrual products. It's up to schools to choose to provide those products to a broader range or to grade school level girls. Our recommendation to the Ohio legislature was grades 5 through 12, because we know that the age for girls to begin menstruation is really beginning in 3rd and 4th grade. So that would be certainly the age that we would recommend, but given their limited budget in the Ohio budget, they started at 6 through 12. But by providing access to those products, schools can eliminate a barrier to regular attendance and start promoting healthy habits. Next slide. Each school district or other public school and chartered non-public school that enrolls girls in grades 6 through 12 shall provide those products to the students. School building, which is how they deem this, means any facility that is owned, leased, or under the care or custody of the school district, board of education, or other public school. So beyond just the school buildings themselves, any entity that is a building that is owned by your school must be incorporated into that. They have also determined that all products shall be used for only on school premises. I believe that students can make a decision around how they use those products and if they need to take one home with them if needed. But also, each school district shall provide or shall determine where those feminine hygiene products are to be kept in the school. Again, best practices are to keep those in no-cost dispensers. Those are usually hands-free dispensers in bathrooms. The whole point of this legislation is really to make them the most accessible so that students are not having to leave class and use valuable time to either go to an inaccessible place like a principal's office or a nurse's office that may be way out of the way, and they may not have the time allowed to be able to do that. So make it available where they will be using the bathroom and using those products. However, each school district is able to choose which feminine hygiene products to provide and what type of dispensers you would like to provide. So even though the products have to be available starting October 3rd, school districts it is up to you to provide in what way do you want to provide those. So if dispensers are not in and available at that time, you have to make them available in some other way until dispensers are available. Next slide. Can you go to the next slide as well? Thank you. Schools, as I said, can pick which type of dispensers. Some of those could be mechanical wall units. Those could be, as I said, hands-free, and they could be anything as a basket. Again, best practices across the United States is not baskets, especially if you're trying to deter from overuse or those who are looking to potentially take some for home. However, they also have said that if you can convert your existing dispensers from coin-operated to non-coin-operated and make those no cost, you're also able to do that as well. Next slide. Because I know we are getting close to my 5 minutes, I will hurry up. This goes through certainly that the deadline for the dispenser funding was 9/15. You can go to the next. Next slide. Oh, sorry, nope, you're on it. My apologies. It was identified that schools and districts should receive their funding allocations for the dispensers in October. So I think that is hopefully a quick turnaround time as they realize that schools will be taking on potentially a large funding burden. They also provided a spreadsheet online that outlines their methodology for how much funding they believe that Ohio Department of Education believes that each district would receive in funding based on the number of students that you have in your district, the number of buildings that you have, and the idea that the average cost for each dispenser would be $300. Next slide again. As you can see here, the estimated amount that would come to Cincinnati Public Schools for your district for dispensers is estimated at $37,200. They have not evaluated a cost for products yet, but I would imagine that they might do something similar at that time. Do you have any questions?
Thank you so much.
Yeah.
I will look to my right. Questions?
Thank you, and thank you for the presentation. It's moving along. I'm happy to see it's moving along too at the state level,
Yeah.
and really appreciate that. And I was very happy that you mentioned and included in here that it's being expanded somewhat to make sure that kids in lower grades might have access. And it's ironic and timely of this presentation, because I had a parent approach me last week who was freaking out because her daughter, who is in grade 5, began her cycle. And she was freaking out because of what you said, and afraid to send her to school because she wouldn't know how to take care of herself.
Right.
And so I am encouraged to hear at some point, and this is for Dr. Little, that we might consider at least talking to the schools about maybe having something available for kids at that age. And I would even encourage in-school education, one-on-one, maybe to include the parent, absolutely.
Thank you.
And to help the kid help the young lady feel more comfortable about it. But I'm so pleased to hear about it. And
Thank
then
you
I
so
have
much.
a question for Dr. Little.
And I'm just going to kind of go behind her. I am so excited to hear about this, and especially as you're looking at some of the young girls are starting as early as 3rd grade, 3rd and 4th grade. Shocking. But I'm happy to hear that this district will be taking part. And I do want to thank you for coming and sharing all of this great information. I do have a couple of questions for Dr. Little, and I know you may not be able to provide every single detail, but I am curious in terms of with this October 3rd deadline, you know, what are we going to do? What is the plan? Are we going to provide baskets for right now so that at least the particular students will have access? I just have lots of questions regarding that because I do think that this is a very important initiative. And then I will let Board Member Jones. Oh, I did. Yeah, I did. But then I'm going to say, you can ask it after he answers.
Yeah, just thinking about, well, board creates policy, but I can't off the top of my head run off every single policy. But we didn't know, absolutely not. But do you know how many gender neutral bathrooms we have across the district? And you know, how many, not only how many, but is that decision to have a gender neutral bathroom site-based? So do schools have the authority to sort of make that decision for themselves?
I will certainly have to follow up on that
Yes.
question
Thank you.
to gather the data and look at what the policy says on central decision versus site-based decision. To Chair Weinberg's questions, can certainly provide some updates on that. So we did meet the September 15th deadline. We did submit our request for funding for this cycle. We are still awaiting to hear exactly what that dollar amount will be from the state, but our application was put in. In the interim, we've also gone ahead and purchased a round of dispensers and product, which we expect to arrive in the district this week and be installed in time for that October 3rd deadline. So we ordered 76 dispensers in this first round, which will give every school with high school grade levels 2 dispensers to start with. Every other elementary school with the 6th graders will get 1 dispenser at this time. And we purchased about $20,000 worth of product to get those dispensers going. We can't talk about this topic without also appreciating and recognizing our partnership through Girls Health Period and the work that they do across the district and really across the community on this topic. They are currently supporting 31 of our schools with product, and so we've been able to provide free product. I also learned from them to use the term menstruator.
Yes.
Yeah.
So we have 31 schools who are receiving product for them and have been for quite some time, and they're certainly interested in continuing that. So as we think about sustainability, I'm in active conversations with them to really think about what a long-term plan looks like for this engagement to continue. We talked about younger age, young girls who are starting their cycle sooner than 6th grade and making sure that there is product available, and also education. That's one of the things that Girls Health Period really focuses on, is education for all students, regardless of gender, and for families. And so trying to think through a way to sort of systematize that in our school buildings as well. But to summarize all that, we think we're on track for the October 3rd, but we know that we will likely need more dispensers and more product, but we're going to engage with schools to think about the right location so that they are convenient as we add a 3rd or 4th or 5th dispenser into buildings.
That
Thank you so
sounds
much.
great. And I think my question for Mary would be, is there anything from the district standpoint in terms of from the county as well, connecting for future,
Yeah.
you know, grants or something? I know that
Yeah.
the funding will go away.
Sure, yes.
So what will
So-
be the next step?
I would encourage Cincinnati Public Schools to work with Hamilton County ESC, who I believe is planning on collecting data from all of the school districts in Hamilton County to have a better understanding about how much money was requested for dispensers, if there is a gap in funding at all, and what that can look like, as well as for products going forward, so that we can start tracking what the actual cost of this is, and see if there are any gaps and a need for additional funding. And I think we're looking at how we can assist in that.
Right. Well, thank you so much. Very
Yes.
informative.
Thank you so
Greatly
much.
appreciate you.
Thank you.
Up next, we have Dr. Little, and he will be going over 3 different topics for today.
Thank you, Chair Weinberg. I think like last time, do you want to take them one by one?
Yep, you can do it all together.
All
Yes.
right. So we're going to start with a brief update on physical and mental health. If we can go 2 slides forward, Rob. Thank you, sir. So I shared this data at our last session, but just wanted to remind the committee where we are in general. So we know we have 25 school-based health centers that got discussed last week in the joint meeting. And through the third quarter of last year, we had over 3,100 community members served specifically for mental health related services through that work and through what we do with MindPeace. We are, if it's okay with the chair and the committee, hopefully at our next meeting, we'll actually be able to have MindPeace here to talk a bit more in depth about what they're seeing and the work that they are supporting our students with across the community to go deeper there. There is, just by way of FYI, in case the members aren't aware, there is a full community-wide group digging into mental health access and challenges right now, really spearheaded by Interact for Health and other philanthropic organizations, working to do a landscape analysis around mental health over the next few months, and then at the start of next calendar year, really digging into a long-term plan. And so CPS is excited to be a partner and participant in that work, because we know that this is a really important need for our students in our community. It is one of the actions in the draft strategic plan, and we want to continue to be able to collectively put resources and support behind it. I want to talk about what we're doing more at the tier 1 level. So for every student on the next slide this year, as part of the Safe Students Act. So if you hear me say Safe Students Act or House Bill 123 today, those mean the same thing. And that is requiring districts to provide programming for every 6th to 12th grade student this year and each subsequent school year on 3 really important topics. So suicide awareness and prevention, violence prevention, which includes some focus on dating violence prevention as well, and social inclusion. So we are very excited about this opportunity to engage with all of those students on this topic and trying to just create a culture within our campuses where folks feel comfortable, like recognizing and discussing these challenges with key support folks at each school. So next slide gives you a quick sort of roadmap for how we're going about the work this year. We are in quarter 1 of the school year right now, so we're focused on that social inclusion. This intentionally ramps up to the more difficult conversation around suicide awareness and prevention, so trying to create spaces of safety and sort of vulnerability in the campuses. So we start with social inclusion this quarter. All of these have materials and curriculum which are provided for free through the Ohio Department of Education. So we did not have to create anything, nor did we have to purchase anything, but our team did vet all of these to make sure that they are the quality and the experience that we want for our students. So we feel good about this opportunity. So there's an entire resource kit and toolkit that the Positive School Culture team put together around these to help both prepare for doing this programming with students, actually deliver the programming, and then follow up. So social workers are engaged across the board in this, but each campus ultimately will create its own implementation plan. So some campuses may do this in a classroom, so maybe an advisory, they're rolling it out. Some may pull grade levels together or do an assembly, so they have lots of options, but we're making sure that the social worker in every building is ready to support and engage in that as needed. In the second quarter, we will go to the violence prevention topic. Again, there's a full implementation toolkit that will be provided. And then in the third quarter, really focusing on suicide awareness and prevention across the board. Again, every 6th to 12th grader should participate in this programming this year, and then we will continue it into subsequent school years. We will also be able to, if the chair asks, to be able to give updates on this throughout the year to say, here's how each of these went through this Superintendent Student Leadership Council, which the board will get to meet next month. This is something we'll follow up on them with as well and get feedback on how to think about this implementation in a way that better engages students. So we want to constantly improve on this, but are really excited that this is rolling out. Want to do questions on this one or go to the next one?
So thank you so much for this. Oh, go right ahead.
Before you get to the second presentation, I'm happy to say this is a lot and we've moved forward. I'm very happy about that. And very happy that that the district followed up with MindPeace to begin to work more on collecting data. Now, my question is, will that data be able to tell us how their services impact students, particularly around attendance in classrooms? Because I know many times they have to pull the kid out of class. So will it be able to get that specific with us?
That is
You read my
exactly the
mind.
conversation we are having with them, and in turn through MindPeace to the providers. So they have ramped up their data collection even from the partner agencies that are working with them to be able to do that type of analysis. We obviously can't do that yet, but that's what we're working to make sure we have the infrastructure in place this school year to be able to do.
So with not being able to have that information, are you saying probably a year from now to have the data?
We will actually get the first report at the end of this month, so we've sort of set up a monthly
Okay.
reporting cadence with them. They've done work sort of late spring throughout the summer with their partner agencies to look at this. And then we're also engaging through separate conversations with Children's to figure out how best to like aggregate and capture this. So not sure that it's going to take a whole year, but
Good.
we're in the process of figuring out where the gaps are.
Good, definitely.
I just want to comment, and I don't want to just bug on this too much, but having worked in the field and been around when MindPeace was first created and working with the agencies around that, I mean, the agencies do collect data, and they do it for their funding sources and what have you. So it really shouldn't take that long. If they're collecting data for their own internal processes, it ought to be a way for us to easily access what happened without having to wait a year. Now, what I don't know is how much what type of oversight Children's has. I do know MindPeace is connected to Children's, so I don't know that piece. But it would seem that even starting with some basic data, clinical data that impact us, attendance and dropout rates, or whatever, would be a healthy start. So I know the data's there.
Yeah,
I don't know why
we
it's
agree
taking
with
so long
you
to get it.
completely. I think getting it through MindPeace to us has been the challenge, because you're exactly right.
I
The
agree with that.
organizations have it.
Okay.
Well, I do have two questions. My first question is, what is being provided to our student athletes in terms of for mental health?
Yeah, so student athletes are obviously included in all of this programming, which is district-wide, as well as what our social workers and counselors do at the Tier 1 and Tier 2 level. And if a student athlete needs a referral to a mental health provider through MindPeace, they certainly have access to that as well. In addition, through athletics, there is a specific contractor set aside to support mental health of student athletes. So if a coach or an athletic director, sees some signs and is concerned about a student, they can connect them to one of those providers directly, which is something that the team is also trying to make students and families more aware of, so that we're fully accessing those services to the extent students may need it.
And there's one quick question. How does this work with the Dating Violence Prevention House Bill 19, the Tina Broder Act, I think that's correct, that has been also mandated for all schools in Ohio to provide? And I guess this bill was passed in 2010.
Yeah, for the most part, this is in addition to that legislation. There's some overlap in the violence prevention, but the legislation that you just referenced is really covered through health curriculum by and large. So when students go through their health coursework, they are getting the required sort of opportunities to engage in programming around.
Any further questions? All right, next topic.
All
Great
right,
job.
we will go
you.
to, thank you. We will go to athletics and extracurriculars. And a sort of litany of things to update on here. We've got several safety-related topics as we think about athletics, but also just want to give the committee a sense of where we are in terms of participation as well. So next slide, Rob. Thank you. We'll start with athletic trainers. We know this has been a topic for the past really 13 months or so in earnest, as we've had some changes with how athletic trainers are provided. This just gives a quick timeline. So in 2019 and prior, the district got all of its athletic training support directly through Children's Hospital. In 2020, before the pandemic hit, The Children's Hospital and the district were talking about potentially co-contributing to the cost of those athletic trainers. So the district was preparing to set aside up to $60,000 to help fund the cost of athletic trainers. Obviously, COVID came and that put a change in things for sure, both for students and for the district. As we entered last school year, the 22-23 school year, the athletics team was expecting Children's to continue to be able to provide athletic trainers. Children's Hospital was not able to do that, so the athletics team had to go find alternate sources for athletic trainers. So last school year, we then started to contract with those three agencies on the right, so Mercy Health, Tri-Health, and Walton Mobile. That is the same story this school year as well. We currently do not have any athletic trainers provided by Children's and are continuing to contract through those three agencies to provide coverage to our schools. There is a link for the public where you can click on the bottom left of that slide and sort of open up which company supports which schools. We also, and this was discussed in a board meeting a few weeks ago, ensure that contact sports get the most sort of coverage both at practice and in game. So, every game has some coverage, whether it's through an athletic trainer or a team doctor for contact sports. And then for non-contact sports, they really rotate days to make sure there's coverage across the board and there's other folks on the team to provide support in that way. One note about Mercy Health, they had 2 athletic trainers dedicated to the schools that they support who ultimately left. So they are actually using other staff in the organization to provide coverage for us right now while they are working to hire back full-time athletic trainers for the district. We haven't lost services, but they're working to sort of cover the need in the interim. Next slide, Rob. The other thing we obviously think about with contact sports, particularly football, is how we provide preventative care for our students. So one thing that we wanted to call out specifically for our football teams, you see this image on the right, are these Guardian caps. So at practices, our teams are adding on these layers of cushion on top of their helmet, so practice becomes an even safer exercise, even when we have a full contact practice. So those came into play last school year, and we continue to use them this school year. In the event that a student is injured or has a concussion, we follow the Ohio State Athletic Association guidelines around concussive protocols and return to play. No student is allowed to return to play without getting medical sign-off to do so. And our coaches are all trained in a variety of things, from first aid and CPR to using an AED, to being able to respond to sudden cardiac arrest as well. They actually went through a revised and very robust sort of coaches clinic this summer where they got this information and more. But the athletics team has done a lot of really good work to make sure we've got infrastructure in place and we've got people trained and ready to provide supportive care in the event that that's needed. Next one talks about heat advisory. We know that it was feeling a little warm to folks back in August, and there were questions about heat safety and how do we handle practice and games, and we had a number of games that were actually rescheduled because of this. That little image on the right is actually something called a wet bulb globe temperature monitor. It is a mouthful. But this is what the Ohio State Athletic Association actually sets its guidelines around. So if the reading on that gets above 89.8, those heat advisory guidelines kick in, which is more mandated breaks, making sure that students have access to water frequently, considering alternate placement. So maybe we move practice from inside or from outside to inside, or we end up canceling and rescheduling altogether. So all of our schools have these. This is what they monitor and use. And then in the event where it was warm, sort of district-wide, is what our athletics team uses as well to decide if we're going to continue with practice or games. And then to get to the participation side a little bit, we'll sort of work our way through the continuum, starting here with elementary schools. These two charts show the types of offerings that we have across the district, comparing last year's participation to, or sorry, 2 years ago participation in 21-22 to last year's participation in 22-23. All of these are highlighted green because they all increased in terms of student participation. And that's something we're looking to replicate again this year, is to continue to engage more of our students in more of these opportunities. We had a 32% increase year over year, and we're certainly doing everything we can to sort of match that number as we continue on. There is also a link in the footnotes in case the public wants to see specifically which schools offer which of these opportunities, because not everything is at every school, but we do try to really balance out a good slate of offerings for every building. The next slide shows us what our K-8 schools are up to. All of them have basketball and track and field. We see that flag football and volleyball is a bit more dispersed, but this is the first year we're actually piloting flag football at those schools. So we've got 4 of them that are trying that out. We're also looking longer term at soccer. So the athletics team always has something in the works to be able to expand opportunities to our students. And then at the high school level, this shows you participation counts by season, by school. One thing to note here is those participation counts are duplicative. So if a student participates in multiple sports or multiple seasons, they are counted twice. So we had 5,600 sort of participants, but that accounts for 3,800 actually individual students. So just under 4,000 individual students participate across the board at the high school level. 1,000 of them actually are in 2 sports, and nearly 500 participate in 3 or more sports. So you got some really committed athletes, and then others who are doing what they particularly enjoy or trying something new out. And that is the athletics and extracurricular update.
Can you actually go back to the original first slide? I do have a couple of questions. I'm going to defer to my board member over here first before I start asking my question.
Thank you. Good presentation. Curious about the number of, I have 2 questions. One, curious about the number of AEDs. Are AEDs provided at every site, every game, on site? They're on site.
On the field, I will confirm for you. I know that all of our facilities and all of our school buildings have AEDs, and many have multiple AEDs. I don't want to tell you the wrong answer, so I will confirm on the field.
Yeah, and I'm asking that question because it doesn't help us if it's not accessible. And with these, we're hearing more and more about accidents in football and basketball where kids are falling down, and if they need an AED, it's not there. So I'm really concerned. We also had an opportunity to get AEDs through, what's the football player's name?
Damar Hamlin?
Yes. So, and I had asked the superintendent about it once, if we could follow up to see if we did that. I believe what she said is that we were connected somehow, but I don't know if we actually received any donations.
Okay, we'll get you an update on that.
Thanks. And then my other question is, so the contract with Children's around athletic trainers, did they not renew because they don't have enough trainers, or they just decided not to do Cincinnati Public Schools?
It's a bit of both. We have a follow-up meeting actually with them next month, so we'll get some updated information. Part of it feels financial, and part of it feels like a pipeline challenge. So they and other organizations are struggling to get more athletic trainers coming through. So that is part of it. I will say that there's real insurance implications here. So we have a contract where we are paying these 3 organizations, but at one of our schools, for example, Tri-Health actually pays us to do that work, because as they get insurance reimbursements, that is financially fruitful for them. So there's certainly a financial aspect to it.
Thank you.
Oh, right, Dr. Little. I may not be your favorite person after these questions. So athletic trainers are very dear to my heart because, obviously I competed in a sport of track and field for CPS schools, and I enjoyed having my athletic trainer on the side whenever I was injured. So I have a couple of questions. Rob, if you can actually click on that little blue line that says here on that slide. You referenced about some of the schools don't have coverage, they have coverage, but there's on a rotating basis. And so for me, when I looked at that list and I kind of broke things down, I'm a little confused as to some of the schools only have a trainer once a week. but they have sporting events and practices every single day, which then tells me that there is not coverage at that particular school on a particular day. So if you look at Aiken, for example, they only have a trainer on one day, Gamble one day, Hughes one day, Euler, Riverview, and I think Spencer and Taft all share a trainer. So that's 4 schools sharing one trainer. Then you have Schroeder that has one day, and then you only have 3 schools that have it every day. So can you just explain that a little bit for me? Because I know we've been getting a lot of emails from parents and concerned individuals about the access and it's equitable for our student athletes and our students.
Yeah, a couple of things to sort of walk through here. The first is how coverage is prioritized. So again, contact sports are prioritized always over non-contact sports. Practice coverage game coverage is prioritized over practice coverage as well. So for every contact sport game, we have somebody there, whether it's the athletic trainer or a team doctor. So that's fully covered. I think you're asking specifically about the practice coverage rotations.
I'm asking about practice and also competitions because I do think that there are some cases that they have not had anyone. They've had to refer to the visiting team's person.
Remember that question from you a few weeks ago. We actually had our team doctor on site. There was another team doctor responding, but that was not because we didn't have coverage. So we actually will have an athletic trainer or a team doctor at each of our contact sport games. And right now we're obviously in football season. The comment you made about the rotating schedule, I do want to clarify that. That's associated with Mercy Health, and that goes back to the comment I made a few minutes ago. So that's really rotating who's doing the coverage. So they may have you there one day, me there one day, because they don't have a dedicated staff member yet. Not that it's impacting the coverage that we're getting.
So that doesn't mean that on Monday they're going to one school, Tuesday they're going to another school, because it looked like that on the schedule is that they're rotating that way.
It could, because practice schedules are different. That's the other thing to sort of keep in mind here. Not every school offers the same types of sports. So you see Euler, Riverview, and Spencer in there. They don't all have the same things going on. So that's part of what the athletics team works with the providers to really understand the practice and game schedule so that coverage is provided to the maximum extent possible. Did I get all your questions?
I think you did get most of the questions. Moving forward, can we magically have more trainers? How is that possible? I know the request, right?
So there's 2 thoughts or 2 sort of approaches there. One, we will continue to engage with Children's to see what opportunity looks like there. But the other is budgetary. So we know that the cost of those contracts this year sits in ESSER at around $500,000, and that's something the board is going to have to grapple with moving into the next budget cycle.
And Rob, can you go to the next slide? Yes, I think this is a slide talking about concussions. And can you just reiterate, you stated that there is a concussion protocol in place. I just wanted to hear that one more time to make sure I heard correctly.
Absolutely. We follow the OSHA protocol. It's actually linked in there again if the public wants to see it, which lays out return to play, return to practice requirements, as well as medical evaluation to be able to do so. So our district follows all of those protocols.
And my last question would be regarding extracurriculars. If you keep going to the slide again, sorry about that. One more. Yes. So I noticed that I did not see tennis, pickleball, esports, or chess on that list. And I know that we have that. So will that possibly be updated or?
They're not on here for a few reasons, and partly because they're not all formally incorporated into offerings. So students have access to them, and let me just talk through those 4 really quickly for you. We'll start with tennis. So right now, 7th and 8th graders at Walnut Hills have a sort of standard tennis offering. The athletics team is working with the Cincinnati Tennis Foundation to expand those offerings across the community, actually working to get a combined program for junior high students. So maybe it's not going to be each school, but they can come together and actually form a tennis club or competition, similar to what we do with some of the elementary things. We also know, I see Sally in the audience, but our good friends from ABC are doing some work around tennis as well, providing opportunity, I think right now for 8 schools to have students engage in tennis. So as that becomes more systematized, yes, it will start to be included in the numbers, but that really signals that it is earlier in its development as a formal offering across the district. Same thing with pickleball. We're excited that we got some donations last year and real energy around pickleball. We are piloting that at 6 elementary schools this year, and that is something that we also look to grow. Esports is growing, but that is also a smaller program at this point. Last school year, we were at 4 schools. We're hoping to at least double that this school year, so that will continue to expand out as well and ultimately get included. And then chess is the smallest of those 4. We've got some schools that run like chess clubs or programs, or that may be part of what after-school partners are doing, but we don't have a sort of formal wraparound around chess. Athletics does support Brain Bowl in the academic quiz bowl competition, so we are looking at including chess as part of that offering, but that's early in development stages right now.
Perfect. Those are all the questions I have for right now.
All right, last one. This is on pedestrian safety, so we're taking quite a turn through very different topics today. But really wanted to focus on an update around crossing guards, if we can go to the next slide. So 2 slides here give quite a bit of history and data. As we think about pedestrian safety, crossing guards are obviously the key investment in that work, making sure that our students can get to school and get home from school safely, particularly immediately around the school. We know that the landscape here, though, has changed pretty dramatically over time. So this school year, we are under contract with the city to spend just over $1 million. If we look back, 7 years ago, that's a 48% increase in cost for crossing guards. So cost has gone up pretty dramatically. We highlighted the 2 sort of COVID years in here because they look a bit different. That darker bar in the actual cost is really low, but it's artificially low because schools were closed for most of those months. We were doing virtual learning. So that's something to keep in mind. The other driver for cost, which is part of what we're doing to think about recruitment, is an increase in wages. So last school year, raised the minimum wage for crossing guards to $15 an hour, but we know that does drive up the total price. Next slide will sort of show us impact on staffing. The line here shows the total number of crossing guard positions. So that has also gone up over time. I would remind us that we added high schools in the 2021 school year to have crossing guard support. Previously, it was just elementary schools that were receiving support, so that obviously drives that total number up to some extent as well. But the more troubling data point on this slide is what the bars are, which is the number of vacancies in crossing guards. Last school year, at any given point in time, we had 70-ish vacancies in our crossing guards. So as we think about this long term, one more slide if you don't mind, Rob, there's just, first, actually before the next slide, we do know that there is work underway, and this got referenced last week. Go forward one more again. So the sort of city and others came together around a public safety campaign, and we get to celebrate Natalia on Thursday for winning that. But our students actually have really good thoughts about everything, including pedestrian safety. And so Natalia put together a PSA on how to promote pedestrian safety. So we're really excited to congratulate her and celebrate at Hyde Park on Thursday. The public can actually, I think, click on that and watch the PSA if they want to. But the last slide here, I think, just tees up questions that we have to grapple with over the next few months as we think about moving into next school year and certainly thinking about budgetary decisions. Right now, crossing guards are staffed by the city, so our contract is to the city and in turn who hires the individual crossing guards. That is part of what we need to think through. We also need to think through if we need crossing guards at all 170 locations, or if we look at data, if that gets revisited based on traffic patterns, walking patterns, those sorts of things around school, and continue to need to have conversations with the city and with community partners about non-crossing guard factors into pedestrian safety. So what does lighting or signage look like around our schools?
Those are all definitely very good points that you bring up, and I thank you for such a great presentation. I'm going to look to see if Board Member Jones has anything to add.
I don't, not on this one. Great, great presentation.
Yes, so thank you so much. So we are now moving on to, I think we are on other business. I'm going to ask my colleague if she has anything to add in terms of other business or new business. I know I have three things that I wanted to bring up, but I'll let you go ahead and go first
No,
if you have
my
anything.
only question is, so we meet quarterly, so our next meeting will be in December? Is that
Phyllis,
correct?
I'm going to look to you.
Okay, that's fine.
Very good.
I just wanted to clarify.
To clarify. So my three things that I'm going to bring up into other business is the topic of nurses. So I know we talked a little bit about that in the board meeting, and it continues to be a concern. And just kind of wanting to know moving forward, I guess we'll probably have more dialogue on that. Just wanted to bring it up. I know it was brought up to my attention through an email. And the next thing is I wanted to give an update about school bus safety from the state. And I wanted to kind of read a little bit of this. I had a concern. I was actually watching the news one night, and sure enough, it came up about what the governor is planning to do to help with the safety of school buses. So I wanted to just read that I had requested at the last meeting an update on school bus safety, noting the tragedy of a crashing of a school bus in Clark County. On August the 30th, our governor, Mike DeWine, announced the creation of a 15-person Ohio school bus safety working group, which I am not on, but anyway. The Ohio School Bus Working Group will cover the following topics. So they're going to do school bus regulation, bus design, maintenance, and inspection, school bus safety technology, crash risk factors, lessons learned from other school bus crashes, school bus seat belts, and then also safety of special populations and critical incident protocol. So the first meeting that the Ohio School Bus Safety Working Group will have, that they had, it was on September the 12th. They will have a next meeting that is open to the public to view on YouTube using this particular link. So I wanted to publicly state it so that if anyone wanted to watch, it is https, the little colon marks, // www.youtube.com/ Ohio Public Safety. And in regards to our federal level, in early September, the U.S. Senator Sherrod Brown introduced the School Bus Safety Act. And this legislation would implement recommendations from the National Transportation Safety Board regarding school buses and requiring seat belts. So stay tuned. And the last thing that I wanted to bring up, we had a parent contact us. We actually talked about this in the policy committee that I also sit on. And a parent of a CPS student brought to our attention, can I talk today, to our attention the ALICE drill and lockdown drills and a concern for the mental health of students moving forward. And I know that we're going to get some follow-up about that. So I just wanted to bring up those three items, and if there was any discussion or comments from my colleague. If not, nothing, Board Member Jones? Okay.
I'll save it for December.
Save it for December. And then, of
Can I
course.
give a quick response to the ALICE
Yes,
drill and the lockdown piece?
Yeah.
So a few things for the public, parents, community to keep in mind. Obviously, the reason we do drills is to be prepared in the event that something tragic happens. So these are really important moments to prepare and to work through a variety of circumstances that come up. That said, we always want to be sensitive and supportive to specific student needs. All of the drills are scheduled at the campus level, so there are no surprise drills for schools. So each sort of principal and school team plans when they schedule those. We certainly support them with knowing the parameter of time to get the drill done, but the specific day and time is chosen by the school. And we encourage families, if they have these sort of concerns, to get with the school to think if there are alternative considerations, but know that we will continue to emphasize the importance of drills because of the need to be prepared if something does happen, but we'll work through specific circumstances. Yeah.
Okay. I think we have reached the moment of time. Do we have any public comment, Rob? Anyone in the audience or anyone online?
Yes, to the chair. We have one speaker, Sally Grimes from AB.
Okay, come on up. And Sally, you have 10 seconds. I'm just joking.
I'm getting pretty good at this.
I'm kidding.
Okay, good afternoon.
Good afternoon.
My name is Sally Grimes. I'm the Executive Director of Activities Beyond the Classroom, better known as ABC. ABC is a standalone 501c3 nonprofit that for almost 20 years now has supported extracurricular programs for CPS students through fundraising, citywide partnerships, and contracts with the district. One of our partnerships is with Children's Hospital, and I've been in touch with them regarding athletic trainers. We've had quite a few conversations around the subject, and I'd like to share what I've learned regarding the history of athletic trainers and the relationship between Children's and CPS. Children's Hospital has been standing by to collaborate with CPS on providing athletic training for our student athletes. The representatives I'm in touch with are very appreciative of CPS appropriating athletic training in the budget. But in order for Children's to provide trainers, they require two critical elements that they have not been able to secure yet with CPS. They need at least a 1-year lead time, and they need a multi-year contract. First, Children's cannot hire staff, including athletic trainers, with only a 1-year contract. A multi-year renewable agreement is required in order for them to recruit, onboard, and prep trainers to be at CPS schools. Second, the timing of the contract or MOU is key. Children's cannot wait until July 1st for a budget to be passed before they begin recruiting and hiring athletic trainers for an August 1st start date. They require at least a year's lead time in order to properly plan and prepare for the number of trainers needed in CPS. Children's Hospital is standing by to discuss athletic trainers for FY25, but those conversations need to start now in order for this collaboration to be successful. Children's hopes to work with CPS to develop a long-term plan that ensures the highest quality care for our student athletes. Thank you for your time.
Thank you. Thank you so much. Do we have anyone else? That's it. All right. Well, thank you, everyone. This now concludes our health and safety meeting. I would like to thank our guests who came out today to present and speak. And then I would also like to, of course, thank my wonderful colleague, Board Member Jones. And I would like to thank the amazing Dr. Little. So thank you all. Meeting is adjourned. And I didn't have